The mental health of children and young people is a growing global concern. More and more young people are finding themselves in mental health crises. Services need to be able to prevent crisis and respond quickly and effectively when they happen. But up till now, we didn't fully understand what crisis care for young people looked like. And how could we improve care when we couldn't clearly see how it's delivered? We're researchers at Cardiff University, the University of Manchester, the University of Plymouth, Aneurin Bevan University Health Board, Vale of Glamorgan Council, and working independently. We surveyed 124 mental health services across England and Wales and found that crisis care looks very different depending on where you live. So we selected 8 case study sites to understand how crisis care for children and young people is organised, sustained, and experienced. We interviewed 137 people, including young people, their families, mental health professionals, and commissioners. From what people told us, we know that crisis services can make a real difference to young people's lives. As one young person said,
"They were always so kind and supportive and helped me through some of my darkest times."
Parents also appreciate the help of crisis services. One told us how
they found us in a very desperate place and they've held our hands and walked us through it.
From this work, we identified 8 key principles that make crisis services better. 1. Make services easy to access. 2. Help people understand and navigate the system. 3. Be clear about what services can and cannot offer. 4. Ensure staff are skilled, supportive, and confident. 5. Provide help that is targeted to individual needs. 6. Maintain stable services that offer continuity. 7. Balance flexibility with reliability to meet local needs. 8. Join up health, education, and social care so they can work together to support young people in crisis. So, what can we do to improve crisis services? Design and commission services using these principles. Young people told us that the best crisis support is well coordinated, easy to access, and delivered by skilled, supportive staff who communicate clearly. Let's make crisis care the best it can be for children and young people. Find out more about the research at www.fundingawards.nihr.ac.uk/award/NIHR 151811.